Today we're going to be talking about a medication called Risperdal. Risperdal is a second-generation or atypical antipsychotic medication thought to rebalance neurotransmitters in the brain, leading to improved thinking, mood, and behavior. Psychosis is often described as a loss of reality because it makes you experience or believe things that aren't real. It can change the way you think, act, feel, or sense things. Today, we're primarily going to focus on the use of Risperdal in treating schizophrenia. Schizophrenia is a severe mental illness characterized by a variety of symptoms. Some are positive and some are negative. The term positive just means that these feelings or behaviors are not usually present. These can include hallucinations, like imagined voices or images that seem real but aren't, or delusions, like beliefs that are not true. Maybe the FBI is out to get you. People with schizophrenia may also experience disorganized thinking or word salad, which is when your thoughts don't come out in a way that other people can understand. Negative symptoms take something away from a person's experience. Negative symptoms of schizophrenia can include a lack of desire to be around others, a lack of motivation, and trouble speaking and thinking clearly. Now that we've covered the symptoms of schizophrenia, we're going to take some time to explore where it comes from. The exact causes of schizophrenia are unknown. Research suggests the combination of physical, genetic, psychological, and environmental factors that can make a person more likely to develop the condition. Some people may be prone to schizophrenia, and a stressful or emotional life event might trigger a psychotic episode. We're now going to take a look at the way Risperdal alters brain chemistry.
So how does Risperdal actually do its work on the brain? Here we have a neuron, and here's another neuron, and they're going to talk to each other by means of neurotransmitters. The one above is going to be the sending neuron. That's where the neurotransmitters are going to originate, and the one below is going to be the receiving neuron that kind of receives the transmission. In between is the synaptic cleft. It's kind of this little area between the two, and then we have receptors on both neurons, and here are the ventricles. The ventricles are full of different neurotransmitters, and in this case, the ones that we're most concerned about are dopamine. So, what happens is dopamine is released from the sending neuron, passes through the synaptic cleft, and then binds to the receptors on the receiving neuron. Where Risperdal comes into play is that it actually blocks some of the what's called reuptake of the receptors. And when that happens, it creates more dopamine kind of accumulating in the synaptic cleft. The dopamine hypothesis of schizophrenia says that the D2 receptors, there's different types of dopamine receptors. The D2 receptor is what contributes to the positive symptoms like hallucinations, delusions, and the D1 receptor contributes to the negative symptoms. So that would be the disordered thought, lack of motivation. It's thought that the D2 receptor is working too hard, and the D1 receptor is not working hard enough. And Risperdal's job is to help restore some balance to the system.
While Risperdal can be incredibly effective in the treatment of schizophrenia, it's important to examine the potential side effects that can go along with this medication. Some are common and some are more serious or severe. Side effects that are more common include fatigue, nausea, blurry vision, anxiety, insomnia, increased heart rate, tremor, weight gain, prolonged erection, high blood sugar, and cholesterol. Serious side effects include decreased white blood cells, inflammation of the heart, severely low blood pressure, urinary incontinence, EPS, tardive dyskinesia, and swelling of the breast tissue. If your doctor prescribes Risperdal to you, it may be in one of a few different forms. It could be a liquid or a tablet which you take daily. There is also an injectable version available. You would get this shot every other week. It's important to remember that Risperdal is a medication that takes several weeks before you'll notice it working. Your doctor may start off with a small dose and increase it gradually over time, depending on how you're doing. While Risperdal can be very helpful in treating schizophrenia, it's important to make sure you continually talk to your doctor and tell them how you're doing. You should also continue psychotherapy on a regular basis in conjunction with the medical treatment. Medication is just one aspect of comprehensive treatment for psychosis and schizophrenia. This also may include behavioral therapy, vocational rehabilitation, and skills training. Even though you might be feeling better on this medication, it's important to continue taking it and receiving treatment. We hope this presentation has been beneficial and that Risperdal can help you in your ongoing mental health journey.